Welcome back to Your Health television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and I'm delighted you could be with us for this next segment. I'm going to take a few minutes to talk about Botox, fillers, and fat grafting. It's pretty tough to pick up a magazine or newspaper these days that has anything to do with appearance and beauty and not see a headline about Botox or the newest filler or even fat grafting. So I'd like to talk about the similarities, I'd like to talk about the differences and their roles and how I use each of those tools in plastic and reconstructive surgery. So let's start with Botox. Botox is short for botulinum toxin A. I first used Botox over 20 years ago when I was a fellow at Children's Hospital for children with a hemifacial paralysis. We would use the Botox to help balance out the face, to help balance out their smile, and bring more symmetry and balance to the face of a child with a hemifacial paralysis. How does Botox work? Essentially, Botox is a muscle relaxant, and I think that's very key to emphasize. What Botox does is prevent a muscle from contracting. It prevents a muscle from exerting its power and its influence on the overlying skin or adjacent structures. As far as I know, the first medical indication or the first medical use for Botox was for children with eye muscles, extraocular muscles that were out of balance. In other words, kids with esotropia or cross-eyed or exotropia, commonly known as being wall-eyed. Children with eye muscle imbalances. Micro amounts of Botox would be injected into an extraocular muscle to help balance out the movements of the eyeball itself. It was soon used for people with blepharospasm, which is a condition where the muscles outside the eye, around the eyelid and eyebrow, in that aspect of the cheek and face, would oftentimes hyperspasm, sometimes even force an eyelid closed or force the eyelid to come down, etc. So it started in the periorbital area as a muscle relaxant, and it's very effective. I think it is a highly effective and safe treatment, particularly for conditions in the periorbita or in the upper third of the face. I like to use Botox in the lower third of the face or middle third of the face very, very judiciously, very conservatively, but I think for the upper third of the face, it has been used the most there. We have the best track record, and it's safe and effective. So let's talk about some of the specifics of using the muscle relaxant called Botox and how we can bring about certain changes. The most common indication for the cosmetic use of Botox is in the glabella. The glabella is the area between the eyebrows, at the top of the nose, at the lower aspect of the forehead. That's called the glabella. There are some muscles there called the corrugator muscles that run obliquely, almost horizontally. The procerus muscles run up and down. And it's primarily those muscles that we want to effect with an injection of Botox. The company calls grooves or furrows or rhydids or lines in that area the 1s and the 11s and the 111s. You'll know that some people giving a look of consternation or constant worrying or sometimes a look of disapproval, people can develop a line or furrow in the glabellar area. And what that does, what the Botox does, is inhibit the action, the contracting action of the procerus and corrugator muscles to contract. It inhibits that contraction, and hence what it does is to stop the accordion action of the overlying skin. These muscles, the corrugator and the procerus, are attached in part to the skin, so when they move, it creates motion with the eyebrows and the skin, and when we get those muscles to relax, the furrow or line becomes much more shallow, much less conspicuous. And it's FDA approved, of course, for use in that area. So that's perhaps the most common use for Botox. Other uses for Botox, and I mentioned blepharospasm before, we can get the lateral orbicularis oculi muscle to relax, to minimize lines on lateral aspect of the orbit, in other words, the side of the orbit, side of the eyelid closest to the ear or the temple, we can get those lines to relax. And so we can minimize wrinkles, ridges, lines, and furrows of the glabellar area and the periorbital area. Now, what about shaping eyebrows? Perhaps some of you have heard about a mini Botox brow lift using Botox. How can we elevate the brows? Well, let's review. There are three main muscles that depress the brow, depress the eyebrow. I mentioned two of them. I mentioned all three of them. The procerus muscle, which runs up and down, the corrugator muscle, which runs horizontally, oblique, and the orbicularis oculi muscle, which actually depresses the eyebrow and helps us to close the eyelids. Those are the three main depressors of the eyebrow. The main elevator of the eyebrow is called the frontalis muscle. That's the main muscle of the forehead, which lifts the eyebrows. So let's think about this carefully. If we selectively use Botox to get the depressor muscles to relax, and we allow the frontalis muscle, which is the elevator, to take over, then we can actually do a micro Botox brow lift. And what I like to do is selectively act on the frontalis and those muscles because, for example, in the ideal female form, if you look through all the glamour magazines, the models have a little peak in the eyebrow at about the outer third, towards the temple, towards the ear, where the eyebrow slopes upward and then either runs horizontal or slightly down. So I can do some conservative shaping of the eyebrow with Botox by affecting the muscles. Sometimes people will come in and they tell me that they would like their forehead lines to be smoothed out. I can do that to a limited extent. My personal preference is I do not like to flatten or relax the entire frontalis muscle. I don't like to flatten the entire forehead, simply because if we make the entire frontalis muscle relax, which is the main elevator of the eyebrow, then the brows will come down. That's a particularly, I think, undesirable look in a woman. Sometimes in a man, a low horizontal brow is actually a masculine sign. It's a sign of virility and strength, masculinity. So we can be a little more aggressive with a male. As an aside, I'm much less likely to do a surgical brow lift in a male than I am in a female. Again, the ideal female form of the eyebrow has a little peak towards the outer third or towards the temple, towards the ear. So that's one way that I can do some conservative shaping of the eyebrow with Botox. Now, very conservatively, as I said, in the mid-face and lower third of the face, with very minimal platysmal banding, the muscle underneath the chin and neck, that sometimes gets some tightening and shows a cord. I can get that to relax. I can do a very conservative or minimal elevation of the corners of the mouth when I will inject the depressor anguli oris. That's a muscle that, just like it says in Latin, depresses the angle of the mouth, depressor anguli oris. I'm very, very judicious, very conservative with using Botox around the lips for lines of the lips, because I don't want to affect someone's smile. I don't like to affect how someone speaks or how they eat or have their comfort when eating soup, etc. So I'm very conservative, very judicious with the use of Botox in the lower third of the face, especially around the mouth. But again, I think it works great in the periorbital area, around the glabella, and around the brow, and the so-called laugh lines and crow's feet. Now, let's distinguish the use of Botox that I've emphasized is a muscle relaxant with a filler. You've heard of fillers. Fillers are things like Juvederm, Restylane, Radiesse, the new one called Bellaterra, etc. There's also a Sculptra. There are two primary categories of fillers. Calcium-based fillers like Radiesse, hyaluronic acid-based fillers like Juvederm, Restylane, the newest one, Bellaterra, etc. Now, fillers are different from Botox. Fillers are volumizers. So let's back up a little bit and talk about a line of expression, a line that someone develops when they're animating, and a line that someone has when they're just at rest or passive. to get a line or wrinkle to become less visible that's present only when they're expressing or contracting a muscle, Botox works great for that. If you have a line that's present even when you're relaxing, even when your face is relaxed, that may be an indication for a filler because it's a volumizer. It can help to fill in that space that's been sort of accordionized for years. If you consider or you think about taking a piece of paper and folding it 10,000 times, eventually there'll be a permanent crease in that paper, similar to a wrinkle or a ridget or furrow. So a filler can be effective for that. To fill in a wrinkle or line of expression is not my favorite use for filler. Actually, I think filler can work very well to do some conservative or subtle facial sculpting and molding. For example, to put a filler like Radiesse or even Juvederm deep against the bone for cheekbones, particularly for a woman and for some men, to augment the cheekbones can be a fairly minimally invasive way to improve someone's appearance. As you know, all the models have high cheekbones. That's one of the hallmarks of a model's face is well-defined or chiseled cheekbones. We want a face that with definition, with some angles, that's chiseled and has contour. So oftentimes a person will notice, and of course this is true with the maturing process, that they lose fat in their face, also in their hands as we mature, and they gain fat in the trunk. So a volumizer like filler is a way that we can help reverse that process to make some areas of involution more prominent. As I said, we can make higher cheekbones. Sometimes we can fill in the tear trough, that groove in the lower eyelid between the eyelid and cheek. We can do a conservative chin advancement even. We can make someone's chin a little more prominent with filler. So I hope that's clear. So the difference between Botox and a filler, Botox is a muscle relaxant. A filler is a volumizer, and there are many different fillers, and they all have different uses. Now, let's distinguish between fat grafting and a filler. Fat grafting is another way that we volumize. The process is we do some conservative liposuction in the flanks, the abdomen, perhaps the hips. We harvest the fat cells. Instead of discarding them like we do for a typical liposuction, we can centrifuge them, purify them, cleanse, concentrate those fat cells, and then re-inject them. For example, we can re-inject them to the buttock area for a rounder, fuller buttock. We can, in certain cases, inject them to the breast for a fuller, rounder breast mound, and also for the face. We can augment the cheekbones. We can minimize deeper creases, for example, the nasolabial folds. Certain times for the glabella, I think that needs to be done very carefully and very judiciously by someone who's very experienced by working in the glabella. We can bring the chin forward a little bit. Now, the difference between fat grafting and filler is that those fat cells are living. They're your tissue. It's a living graft, very similar to a bone graft, cartilage graft, even a skin graft. It's true enough that we bring up some stem cells. Now, the American Society for Plastic Surgery, and I'm a member, we do not advocate the use of the term stem cell facelift because the truth of the matter is that only one out of about 176 cells that we transpose to the face will be a stem cell. But true enough, it does bring up some stem cells. Also, I think it's important to notice that oftentimes people will notice that over the course of the next 6 to 9 to 12 months, the quality of the skin overlying the fat grafting will actually improve. Now, this may be related not just to stem cells, not just to volumizing, not just to moisturizing, but it may be related to bringing up and increasing the number of cells responsive to the estrogen cycle. As most of you know, the estrogen cycle is related, or I should say fat cells, the adipocyte, our fat cell, is important in a hormonal cycle, especially for the woman. It's important in the estrogen cycle. So if we transpose not only fat cells, but some estrogen receptors and cells important to the estrogen cycle, that may very well, and I'm hearing that more and more in the office, that may very well improve the texture, the smoothness of the skin. So oftentimes in conjunction with some surgery like neck lift, facelift, etc. I will do some fat grafting to improve the volume. As I said, as we mature, we lose fat in our face, we lose fat in our hands, and we gain it in our trunk. So we can transpose some of those cells from the trunk to the face. I'll oftentimes combine the surgery with fat grafting, as I said, and sometimes with peel, like a TCA peel, trichloroacetic acid peel, which goes another step forward to minimizing dyspigmentation, improving fine lines, some irides, improving the texture of the skin. So again, in summary, Botox is a muscle relaxant. It minimizes the opportunity or the tendency for a muscle to contract, so then the overlying accordion effect is minimized. A filler that we get out of a box, a Juvederm, Restylane, etc., that's a volumizer. And fat grafting is a surgical procedure whereby we harvest fat from one part of the body, spin it down, purify it, centrifuge it, cleanse it, and transpose it to another part of the body for more volume, and oftentimes to improve the prominence, to do some surgical sculpting, or to improve the health of the overlying skin, because we're probably improving the moisture in the area, perhaps the blood supply, and perhaps the estrogen cycle in that area. If you'd like more information about this or any other issue in plastic surgery, I'm Dr. David Morwood, 646-8661, 831-646-8661. My website is drmorwood.com, D-R-M-O-R-W-O-O-D. I'm in Monterey, California. I'm delighted you could join us today for this edition of Your Health television program. Once again, I'm Dr. David Morwood here in Monterey, California. I'm a board-certified plastic surgeon. Thanks so very much for being with us.